My name is Dr. Mohamed Hosny. I'm a professor of ophthalmology at Cairo University. Today I will try to share my experience of using the BIOTECH IOL, the Trio Optiflex IOL. Over the past few years, actually 3 or 4 years, we started using trifocal intraocular lenses, and all seasoned cataract surgeons that have been working over the past 20 years were very skeptical using multifocal intraocular lenses. We've all had bad experiences with the bifocal intraocular lenses back in the day. Some of us used to brag that we explanted more of these lenses than we implanted, until the era of trifocal intraocular lenses came and we began implanting these lenses. We began experiencing different results. Now, there's a battery of lenses in the market, and this small video is about sharing my experience using the BIOTECH Optiflex trifocal intraocular lenses, the Trio. This lens is a really good lens in my hands. It gives me very good results. It stands out in the middle of other trifocal intraocular lenses in many aspects. There are common things between this lens and other premium trifocal intraocular lenses: that it's hydrophobic, it's an aspheric design, it has square edges. All of this can be found in other lenses as well. But the things that really stand out in this specific model is that it has a pretty much large area for the monofocal zone in the middle. So this is in the neighborhood of 1.2 millimeters, which is a little bit more than other trifocal intraocular lenses in the market. And what this delivers is that it is a little bit forgiving in patients that have a little bit of a decentration or decentered pupil or large angle kappa. It covers a lot of the things that the doctors may miss during the pre-op workup for these patients. The other thing that stands out for this specific lens as well is the color. It has a very interesting color. It is yellow, but not too much yellow. It has a yellow, natural yellow chromophore, as the company calls it. And so it's a blue blocking without really having the flip side of blue blocking intraocular lenses, in that it doesn't alter the color perception of the patient. We all had patients that implanted yellow lenses and natural or white transparent lenses in the other eye, and they really can perceive a difference in color perception. In this lens, the patient doesn't really feel the difference in the color perception. The other thing is that it blocks the UV light, so it prevents or protects the patient from age-related macular degeneration, but does not affect the contrast. So this is something that really stands out for this lens in specific. There's a proprietary technology that they call the BLISS, which is the balanced light sensing system, and it basically means that it delivers light asymmetrically at each focal point. So it utilizes more of the stray or unused or lost light energy. In this lens specific as well, there's something we teach our patients, or we counsel our patients before implanting a trifocal intraocular lens, is that there will be no real continuity of vision. You'll have a focus for far, you'll have an intermediate focus, and you'll have a focus for near. But sometimes the distance between these foci is a little bit blurry. When I started using the Trio, the feedback from the patients was a little bit different. The patients reported continuous vision from the near focus to the intermediate focus, which is basically from 40 centimeters to 70 centimeters, sometimes a little bit more, up to 90 centimeters. So this is a lens that acts a little bit like an EDOF lens from the intermediate to the near, and acts as a very good lens for far as well. I've had good results. I've had happy patients with the Trio lens, and I believe when we have happy patients, this makes us more happier than them. I really do recommend this lens, and it is a good addition to our armamentarium of trifocal intraocular lenses.